Hello, everybody, and welcome to this Bootcamps webinar. We will be starting very shortly. Thank you very much for joining. So I will start just very fast presenting you our housekeeping rules. I'm very sure you're here because you have a lot of questions for your Bootcamps program manager. So we really encourage you to ask your questions, and please do so in the Q&A tab. Any questions that are asked through the chat won't be answered because from our side, it's way easier to answer your questions through the Q&A so we can have control and that we can make sure that we are actually giving you the answers that you need. The slides will be made available through the chat. My colleague Javier will be sharing them throughout the whole webinar. So if you want to download them, you will have them available through the chat. At the end of the webinar, you will be redirected to a survey. We kindly ask you to answer this survey as it is very important for us that you give us some answers and just to make sure that we are actually giving you the information that you need from the bootcamps and that we can keep improving our webinars throughout time. So with that, I can say welcome and we hope you enjoy this webinar and that we can help you answering all the questions that you have. So I'm going to give you a very brief introduction about Eit Health in case you don't know who we are. Eit Health is a vibrant community that includes the world-leading health innovators. We are supported and backed by the European Union, and we work with a lot of startups throughout the years. So what's our goal and what's the main objective of Eit Health? We want to improve the health and well-being of the European citizens. We believe that in order to do so, innovation is key to this goal, and you will see it through our bootcamps. So where did it all begin? Around 2005, Europe decided to create something very similar to the MIT in order to improve and encourage innovation throughout the European continent. It has become one of the largest innovation networks throughout Europe. It brings together around 1,000 partners. Eit Health in particular has around 150 partners that collaborate with us in order to improve innovation. And Eit Health itself was established in 2015 in order to focus on the most challenging health problems. These are our partners. As you can see, we work with world-leading academic institutions, business, and innovators in order to keep driving innovation in around Europe. We are present in around 13 regions. Our headquarters are based in Munich, but you can see that we have people working all around Europe in order to support you, and we offer programs for startups that will improve this innovation throughout your company. We do that in regional offices that are around Europe, and in case you have any questions, you can always reach out to your regional contact in order to receive more support. So every year we have the bootcamps, and the bootcamps, it's a great program for startups that will focus in very key areas. You will see that this year we have offered already 3 in the beginning of the year, and right now we're offering another 3 more that are very interesting, that I'm very sure that you will find that you really, really want to apply to these bootcamps, as each of these bootcamps are very particular and will help your startup grow in a very innovative way. So we have today from Healthy and Active Aging Bootcamp, we have George Pimienta. From MedTech, we have Lisa Walter. And from Interseed, we have Brendan Goss. With that, I let you and I present Jorge to present you the Healthy and Active Aging Bootcamp. So right now I'm giving Jorge the power to share his screen and control mine. Let me know if it works.
I think it does. Good morning, everyone. I think you're hearing me well. Yeah. Let's see if technology will help us. I believe it will. I'm trying to move the slides. Yeah. So good morning, everyone. My name is George Pimenta. I'm here to present the Healthy and Active Aging Bootcamp. It's really a great pleasure to be part of this amazing portfolio. As we were discussing already, there were 3 bootcamps running in the first semester. The three bootcamps representing today are going to be run in the second semester, and the application date is 27th of June. So you still have some days left, and I hope we can sort all that out. So in our case, healthy and active aging is directed to startups that are building solutions that target the silver economy, or let's say the silver consumers out there. So I don't know if you know, but in 2019, just 2 years ago, the statistics said that over 20% of the population in Europe was already 65 or over. So that's a fifth, and this is not it's not going down; it's going up. So there's a huge challenge regarding people getting older, and new solutions are required. So that's why we designed this bootcamp, in order for startups that are tackling this market can validate and have access to training, access to users, and of course, help you build partnerships. So all the bootcamp is designed around the validation of your solution, also giving some business training, some mentoring, and we think we have a really good opportunity for you. So in our case, we designed a tailored training program, and then specifically with the Medical University of Łódź in Poland, we designed a validation week that will allow you to have access to end users that will test your solution in Poland. So how's the bootcamp running? So let me see if the slides go. Yeah. So they're going really slowly. So the application process, you need to fill the application on the to the 27th of June. So that's the deadline, and it's really a simple process. I just highlight a few questions that we ask you. So what's your target? What's your target group, and how will your solution benefit the target group? What's your product or service? So do you have a specific one? What's the maturity stage of your solution, so that we can understand better what are your validation needs? Then what type of validation are you looking for? Is this done just via some questionnaires, or do you want to try some tryouts with age groups? So have you already tested your solution or not? It's important. And which validation exercises? So then we also ask you, how does your solution is promoting a better lifestyle, a more active lifestyle, and what you want to achieve with the bootcamp. So it's not very complicated. It's just this set of questions, apart from the generic ones that you have to do with the context. So it's not very complicated, and we will help you also. We have an office hours on the 21st of June. So if you want to connect directly one-to-one with us, we have a Zoom link that I will share, that you can also go there and share your thoughts. So what's the agenda that we have prepared? So it's we'll have the kickoff on the 29th of August, and on the first week, our training will be focused on business. Okay, this will be done by our partner Trinity College in Dublin. Actually, Brandon is also here in the call with another bootcamp, and it will be remote, online. Okay, then we have a very important week, which is the validation week, that will have an online version, but also a physical version in Łódź, in Poland, where we will have access to end users. And this is both from the medical university, but also from care homes and other groups that Medical University of Łódź has access to. And then we will finish in Coimbra, in Portugal, with the commercialization mode, where we'll connect you with not only end users, but mostly with hospitals and other stakeholders, insurance companies that can connect you and get your business going. So this is the main calendar and the main dates that you need to really put on your calendar right now. And of course, not forgetting that in between these weeks, we will have one-to-one mentoring sessions with our mentors, both from IPN, Trinity College, and Medical University of Łódź. So this is the calendar. Don't forget about the Q&A if you want to join us. So it's going to be at 9:30 Central European Time. You'll have time then to also interact with us if you have any doubts regarding the application process. And I think, yeah, just to present our amazing team. So this is me and Ana Maria from IPN, and of course, Eva and Brendan, also our partners. yes, I would think we'll share the recordings, by the way. So join us, and this is the link. Of course, go to the website. Everything is on our portfolio website for the bootcamps in the IT Health website. And please, on the chat, just send me some questions, and I'll be more than happy to reply. Over and out, Anna.
Thank you very much, Jorge. That was super informative. Please, if all of you are asking questions through the chat, we encourage you to do it through the Q&A tab, so George can actually answer to them correctly. So if you are asking things through the chat, we won't be able to answer them, so make sure to put them on the Q&A tab. So with that, I present you Lisa, who will be presenting to you the MedTech Bootcamp. Give me 2 seconds to share with you the control to the slides. Give me 2 seconds. Let me know if that works for you.
Okay, thank you, Anna. I think it's working. My name is Lisa Walter, and I support the MedTech Bootcamp as a mentor in public funding and other sources of grant funding. This is the 5th year in a row that our Friedrich Alexander University in Erlangen-Nuremberg in Germany, so FAU or FAU, will be hosting the Eit Health MedTech Bootcamp. And I'm really looking forward to joining again this year as well. So why should you apply to the MedTech Bootcamp? The idea is to cover 3 kinds of important topics that you should consider in order to successfully introduce your product into the medtech or digital health market. So the first group of things are things that you know well, such as your product, your team, your technology. The second group is things that you don't know, but you know that you don't know. You know that you should know. For example, the European medical device regulation, other legal aspects, how to navigate or interview stakeholders, etc. The third group is the more critical one, things that are essential to succeed that you might not really have thought about before, such as the core values of you and your co-founders, the intended purpose, lobby work, stress management, etc. So the goal of the MedTech Bootcamp is to cover all these topics and give you a detailed overview of the things you have to consider to launch your product successfully. We are looking for entrepreneurs, innovators, and startups that focus on medtech, digital health. For example, wearable apps, machine learning, artificial intelligence. Have a team of at least 2 people and up to 5 people. A technology readiness level, TRL between 2 and 4, and are incorporated or are ready to be incorporated into a Horizon Europe country. So we have a lot of great partners with experience in medtech and digital health sector. And we've been working together already, most of our partners, for 5 years in a row on this bootcamp. So some of our other partners are Unternehmertum in Munich. This is a German Center of Innovation and Business Creation, the IESE Business School in Navarra, Spain, the Instituto Pedro Nunes in Portugal, the University Hospital in Erlangen, and DKV Seguros. This is a Spanish health insurance company, and the Medical Valley Center in Erlangen-Nuremberg in Germany. We also have additional startups and smaller companies that have partnered with us as well. So this is the main overview of the schedule. There will be an in-person kickoff event in Erlangen that will also be funded by Eit Health. This will take place on September 1st and 2nd. Then there are 2 weeks in Munich that focus on the business model and hypothesis. And then 2 weeks in Erlangen, this is then online, that focus on the health system. This is followed by one-to-one coaching and pitching sessions hosted online by Erlangen and IPN from Coimbra. Then there will be a session held by IESE in Barcelona on entrepreneurship and finance. And finally, some information and sessions on funding and legal coaching hosted by Erlangen. So again, the deadline to apply to the MedTech Bootcamp is June 27th, so it's coming up very soon. And the program itself will begin on Monday, September 5th. As I just mentioned, there will be 4 weeks of program, followed by a week of break. And then week 5 and week 6 will then be the end of the bootcamp. Here's a little bit of information about medtech startups that participated in our previous 4 bootcamps. So as you can see, they come from various countries throughout Europe. Most of them were non-German startups, and all of them still exist today. So we're very happy about that. Also, the teams over the last 4 bootcamps acquired 8.7 million euros in funded and created 86 jobs in the last 4 years. So if any of these questions are on your mind, I encourage you to apply to the MedTech Bootcamp, and I will be happy to answer any questions later. I'm taking the place today of Mariana Meika, who is organizing the bootcamp, and Dr. Heike Leuthäuser is leading the bootcamp again this year. So again, the application deadline is on June 27th, coming up very soon, and we hope to get a lot of applications.
Okay, thank you so much, Lisa. So now I will just show a little bit of a specific addition we have this year to the MedTech Bootcamp, which is the possibility to apply as an EIC selected company. So the idea is that this year there is a pilot program of collaboration between our 2 institutions, the EIT and the European Innovation Council. The EIC, both of our institutions lay in Pillar 3 of Horizon Europe framework. And that means we both have the same objective of boosting innovation in Europe. And therefore, this year we're running this pilot, this collaboration pilot, by which from the EIT side, we are, specifically for this case, supporting some companies coming from the EIC with some specific advantages to access EIT health programs. So we have, as part of this pilot program, the MedTech Bootcamp for EIC companies. And as such, if you apply as an EIC company, you will be able to have this, what you can just see here, 1,000 euros extra for specific mentoring. That's the idea is a little bit that while you run the bootcamp program, you might find some weaknesses, some specific fields where you want to have some extra support, and we can help you with that. And you will also have the dedicated support from one of our team members, one of our venture portfolio managers, to support you along the whole program. How to apply as an EIC company? So first of all, make sure you have been previously supported by the EIC. That's sometimes very confusing because the EIC was previously called the SME instrument. So you have, when you apply, you will see this question that you can see in the screen right now is, or has your company been supported by the EIC? If you say yes, you will have to introduce the PIC number, which is a specific number the European Commission gives to any applicant to the EIC or one of their previous funding instruments. And then you will be able to select one of the programs that is eligible for this call. There are actually other minor programs that might also be eligible. So if you have doubts about that, don't hesitate to contact us. So I think the next slide, you can see our contact details and also our webpage, and you will be able to have some more information in there. And with that, I will leave the presentation from my side and back to Anna or the next book. Thank you so much.
Thank you very much, Javi. So yes, anybody that has already participated on the EIC applies to this special opportunity. But if you haven't been supported by the EIC, you can still apply to the MedTech Bootcamp, just to make sure about that.
Of course, that's just an extra, an addition.
Yes, it's just a special opportunity. So yeah, as George already mentioned, and as Lisa already mentioned, the application deadline for this bootcamp is as well the 27th of June. Make sure to apply before that date. If you have any questions, if you want to have more information, make sure to visit the website. We try to keep it up to date all the time. And if you have any additional questions to the ones you can ask here through the Q&A, you can always reach out to Mariana, who's not here today, but Lisa is supporting her on this webinar. And last but not least, we have Brendan, who will present to you the last bootcamp. Brendan, I will share with you. Give me 2 seconds. I will add you as the spotlight. Okay.
Spotlight. I'm in the spotlight.
Yes.
Okay. I better move slowly so you can keep track of me then, okay? So good morning, everybody. Let me just double check that I can move this. Nope.
Let me try to give you the control again.
Okay.
I think you can do it now. Yeah. You muted yourself.
Thank you, Anna. That's great now. Okay, everybody, thanks very much. Good morning to you all. I'm Brendan Goss from Trinity College in Dublin. So we're the lead partner together in collaboration with our colleagues in Danske Technical University, DTU in Denmark, and Medicine, the Life Sciences and MedTech cluster in Paris, in France. So we're presenting Interseed. Oh, stuck again, Anna.
Okay, I can share. I can change the slides then. You can just let me know whenever you need.
Okay, perfect. So Interseed basically it seeks to address the challenges that life science and big pharma companies face in their digital transformation. What we want to do is introduce new, innovative digital health solutions from the startup ecosystem to address those challenges. We want to basically bridge the gap between pharma's expectations and the challenges they face in terms of how digital is disrupting their operations, from drug design through to supply chain, through to engagement with customers, and bring them closer to the startups by making the startups more commercially credible, more commercially robust as solution providers. So ultimately this will benefit patients across Europe, because currently the landscape that patients experience is quite fragmented. It differs hugely from country to country, even within countries from region to region. So what we're trying to do is trying to create a more seamless digital transition for the stakeholders in the healthcare industry. Next slide, please. What makes us so special? We bridge the gap between agile new solution providers, so the new cutting edge, bleeding edge digital startup solution providers, and the gap that exists between them and industry's ability to adopt these new innovations. Industry can be quite slow and unagile when it comes to reacting to transition or to change within a particular sector. And because it's not their primary focus necessarily, because their business model is one thing, how to actually create more efficiencies within that business model is often quite problematic. So we want to close the gap between the two, the solution providers and the community with the problem. Next slide, please. You just run through that tab, Anna. It should bring up the various phases, I think. You can leave it like that, doesn't really make any difference. So that's it, perfect. Next. There we go. So basically we're offering all things to all men and women. But in terms of digital health, we're offering patients greater and closer engagement with healthcare providers, greater connectivity, and more efficient use of data on their behalf, ultimately, so that they can be supported when they need to be supported. We're hoping to create, for healthcare providers, greater patient relationships, more trusting relationships, ultimately, again, greater efficiencies within that relationship and better outcomes for both the providers and for the patients. From the point of view of pharma and life sciences, we're looking at trying to achieve operational efficiencies, greater commercial insights, better outcomes, reduce costs, and a greater sense or more control in terms of risk management and greater sight over risk. Ultimately, one of the biggest challenges are around commercial capabilities, systems integration, and data interoperability. So if it's, for example, a startup is trying to engage with a big corporate customer like a pharma company, it often faces points of resistance because its solution simply cannot be integrated by that big customer. And what we want to do is try to create a more seamless environment where integration is facilitated more efficiently. Also, issues around regulation, public procurement, long development times, and so on. These are challenges that we hope to try to at least address and shine a light on so that big pharma potentially can do something about it. For the startups, then, we need ultimately to help them understand patient needs better, to improve their technology, to make it more efficient, and also to learn more about industry dynamics so that actually they are solving a problem as opposed to a real life problem and a real life challenge that customers and end users face, rather than simply pretending or presuming that they're solving a problem that doesn't really exist. Next slide, please. The value proposition really comprises our three institutions, as I mentioned. We're looking for startups that are data-driven, digital innovators with customers in pharma and life sciences, which will ultimately whose outcomes will benefit citizens and patients. So we're looking at a panoply of solutions. We're looking for solutions from AI through to blockchain, through to IoT, Web 3.0 industry, 3.0, 4.0, I should say, natural language programming, any cutting edge data analytics, AI plays that you can imagine that will help in that process from drug design all the way through to customer engagement and supply chain, risk management, regulatory observation, and so on and so forth. So we're looking for a fairly broad suite of digital health solutions that ultimately will help solve these challenges. We have partners from Novartis, Roche, and Pfizer involved in the project. And between the three partners in the program, we have great industry engagement as well from throughout our healthcare ecosystem. Next slide, please. I should say, just in relation to that previous slide, what we're doing with our industry partners is that we're introducing them as problem owners who will address the startups and hopefully engage directly with the startups in terms of how those startups can help them. So one of the ideas behind the program as a point of engagement is to operate innovation challenges with those three pharma companies. So the startups involved in the programs will be engaging directly with those pharma companies. And ultimately, what underlines or underpins this accelerator, just anecdotally, but also in terms of the amount of headlines that are being introduced or produced around how tech is disrupting this business model. And this is just an example of how, for example, things like AI are entering into a new phase of disruption in everything from data management and leveraging data to operating more efficient quality control systems for companies, drug design for Alzheimer's trials, and so on and so forth. And that's just artificial intelligence. There's a huge amount of potential solutions out in the market that we would like life science companies to engage with in the startup ecosystem. Next slide, please. The bootcamp focus ultimately will be on making those startups more commercially credible and robust. So you receive support within a fairly programmatic 8-week program, which will be split between several weeks in Ireland and Dublin, a couple of weeks in Denmark, and a final week in Medicine in Paris, where you'll be exposed to the investment community and other healthcare stakeholders. So a real opportunity to improve your commercial business proposition, your commercial model, and your value proposition, and ultimately to get you investor ready. All the while concentrating on those 4 areas that are the core focus of the Eit Health. So with a particular focus, I think, on harnessing real data and healthcare transformation. Next slide, please. You should apply because we're going to help you become more entrepreneurial. We're going to help you become more successful. We're going to help you achieve investment, and we're going to help you achieve sales, basically. That's it. That's what we want to do. That's what the bootcamp does. Okay. Ideally, you'll be of a TRL 5 plus solution. We don't believe bringing companies in with embryonic technology solutions are going to be of great interest to the life science community. So ideally, you will be slightly more mature in terms of your product development and your technology roadmap. Ideally, you will be on the verge of either generating revenue if you're not already generating revenue, which would be fantastic. But in the first instance, perhaps if you've already commenced or initiated customer discussions, would be very interested in talking to you. Next slide, please. General schedule for the bootcamp, kicking off late September in Trinity in Dublin for 3 to 4, well, for 4 weeks in actual fact. Moving on then just outside Copenhagen with DTU for a couple of weeks of activity, and then the final week in November, mid-November, in Paris. I think that's nearly it. Next slide, we see Anna. This is the team. Daniela in the middle has now moved on. That should have been modified. Daniela has moved on to a new position. Benjamin Nakash from Medicine is now our Medicine partner. And we have 3 industry partners, as I say, plus Ireland's Health HSE, which is the Health Service Executive, the national healthcare body in Ireland. And the final slide, I believe. Get your applications in by the 27th of June, like everybody else, through the same portal as well. But tick the intercede box, please. Thank you very much.
Thank you very much, Brendan. So thank you all very much for asking your questions through the Q&A chat. I can see already that the program managers have been answering them. Right now we'll be having a Q&A session where I will be reading your questions out loud, and the program managers, they will decide who wants to answer the question. So make sure to ask your questions right now. I will start already reading some that have been answered, just and also some of the that are here on the chat already. So the first question that I have here is, can companies incorporated in Northern Ireland, United Kingdom, apply for the MedTech Bootcamp? Lisa, I guess that one's for you.
I guess this applies to all the boot camps. Can companies incorporated in Northern Ireland apply to all the boot camps?
Yes, normally they can.
Okay.
They're part of, they're still part of the, we still have a regional office in Ireland, UK, so definitely you can.
You can for sure, yeah. Just from an Irish perspective, you know, there's still that kind of gray area, thankfully, with the protocol, etc., which means that you can still apply and take part.
We have one that I think is very interesting that says, hello everybody, are we allowed to enroll in multiple programs at the same time? So I saw George reply to that one. Yes, you definitely can apply to many programs, but you will only be selected for one. So of course your chances grow bigger if you apply to many, but at the end you will have to decide to which program or which camp you want to work with, as you cannot work with many programs at the same time. We have one, is the Interseed Bootcamp remote?
Yes. We hopefully will be bringing the teams together at one stage, probably in Paris for the final week, for face-to-face engagement. But the program will be conducted remotely.
Okay, perfect. So I saw many questions around asking about the commitment time for the bootcamps. I saw it for MedTech, I saw it for Healthy and Active Aging. So maybe Brendan, you can tell us as well. So I let each of you program managers tell us the commitment time that each of your bootcamps will require. We can start with George.
Hi. So yeah, it's a very interesting question. So the objective is during the training weeks, you'll have online. Let's say the mornings will be mostly one slot will be either the morning or the afternoon, and then there will be 2 days that has to be full time in Poland in mid-September. And then again, in October, we will have another training week. So what we expect is when it's online, it should be a morning or an afternoon, so a slot that you need to commit during the whole week. And that has to be from a senior level, let's say, person from the team, either the CEO, CFO, or a technical or commercial guy. That's from our side.
Thank you. We can continue with Brendan.
At the moment, we're looking for companies to engage with us 3 days a week over a consecutive 8-week period. So 3 days a week for 4 weeks for the Dublin block, approximately 3 days a week, 2.5 to 3 days a week for the block in Denmark, and the final block then in Medicine in Paris will be probably 3 days also. And those days as such will be more than likely morning blocks only. They're not going to be 8-hour days. They're going to be morning blocks because we find that people's attention tends to wander a little bit after lunch.
Okay, perfect. And Lisa?
The time commitment, there's program offered every day during the MedTech Bootcamp sessions.
Okay.
Not the entire day, but it's like roughly half the day.
Okay, super. Thank you very much. I have a question here. I have a question on the chat actually that asks, is it necessary to have been already incorporated to apply and or participate in your bootcamp?
For us, it would be helpful if the business was already incorporated, because we want slightly more mature companies to take part in the program.
Okay.
In healthy and active aging, it's not necessary that you have incorporated the company, as we're going to help validate solutions. But of course, that if the solution is validated, it is expected that the startup will be constituted in the short run. But it's not necessary to apply when applying.
So I'd just like to jump in and say it's the same for the MedTech Bootcamp. So it's not required that the teams are incorporated to apply, but our hope is that you plan to incorporate very soon.
Okay, thank you all. I also saw a very interesting question asking about the selection process, and I'm guessing this can be very interesting for our participants here. How does each selection process works for each of your bootcamps, and what are the requirements that you like to emphasize a lot for these participants to apply to your bootcamps? So we can start with Brendan as well.
We will be bringing in 3 independent evaluators to evaluate the applications. So each of the companies will be scored against categories around commercial potential, market potential, the team, the composition of the team, your experience, the innovativeness of the solution. Fairly standard criteria for selection. We're hoping also potentially to bring our pharma partners into the evaluation process as well at the observer level, so that they're comfortable that the solutions that they see or the applications that they see are aligned with their own strategic interests. But that's not going to ultimately define who's successful or who's not.
Thank you. George?
So in Healthy and Active Aging Bootcamp, all the applications will also be reviewed and scored by 2 evaluators each. And then we'll select a batch of 20 of the best ranked application to have an interview with the team, so with the consortium. And then out of those, 10 will be selected for the final batch. And this selection will be done before the end of July.
Thank you. And Lisa, about MedTech?
The MedTech Bootcamp also has a committee of 3 individuals looking at all the applications, and we'll select the 20 favorites or strongest for an online interview. And they'll rate the applications based on market potential, innovation, and the makeup of the team.
Okay, perfect. I see a very interesting question here as well. Will IP be protected via NDA? For example, for mentoring sessions, I think this is very valuable for startups that have their own products and that they have their IP is very important. So who wants to take this question first? I think, George, you were answering already, so maybe you can start.
Yeah, I was answering in the chat. Yeah, of course, all the mentors, for instance, in our case, have they have in their contracts specific NDA clauses, and we will sign specific NDAs regarding each of the mentors involved in Healthy and Active Aging Bootcamp.
Brendan, maybe you can go.
Yeah, is the answer. They will be protected by NDA.
Okay, perfect. And Lisa?
Yes, as well.
I can add maybe that I think all contracts with mentors in the Eit Health, they must be, they always have this clause. And of course, in the AC, we're providing a mentor, and it will also be NDA protected.
Thank you very much, Javi. So I see some questions about the TRL for each of your bootcamps. Maybe you can tell us a little bit more what's the TRL for each of yours. So Lisa, I saw that question was directed to you and you had a follow-up, so maybe you can help us answering that.
So the MedTech Bootcamp is looking for teams with a TRL of 2 to 4. So the concept should be formulated in an experimental proof of concept.
And I see there's a follow-up question asking if they still can participate if they have a TRL 6.
In the MedTech Bootcamp?
Yeah.
I personally don't think it would be a good fit for the bootcamp at that point. They're still welcome to apply because I think it can be a very individual case-by-case basis. It's something that we could consider, but just if I hear that off the top of my head, I would say it might not be a good fit, but if they're still interested, they can apply.
Okay, thank you. Maybe they can work with Brendan, right? Brendan, your TRL is higher?
Yeah, higher because we want the companies to be able to work or engage more efficiently and more productively with the life sciences industry, and therefore the industry will be more reassured if the TRL levels are more mature. So hence the TRL 5 plus. So for sure, if the solution is of interest, and if the entrepreneur or the founder of that company considers Interseed to be appropriate in terms of what we're trying to do, because we're looking at a broad digital health ecosystem here, and by all means, absolutely consider Interseed. We just feel that if we introduce TRLs that are below 5, there'll be too much of a gap between the expectation of the life sciences industry and the ability for that founder to be able to match those expectations.
Okay, thank you. And George, TRL for the Healthy and Active Aging Bootcamp?
Yeah, so in our case, of course, I think the most important thing is to have a prototype, a functional prototype or an MVP that one can test, either a digital one or a physical one. So of course, it depends a little bit on the stage, but TRL 6 is for sure expected, but lower TRLs from TRL 4 upwards can apply. Okay. And of course, it's if the solution is digital, it's easier to test. If it's hardware, then one has to understand if it's it can be validated on site.
Okay, thank you very much. I'd like to mention as well that if none of these bootcamps is a right fit for you, Eit Health has other programs that are not bootcamps that work with different TRL levels. So I'm going to share with you the link on the chat where you can find the programs that are currently open, and you will find in the requirements the TRL levels that are required to apply to each of our programs. So is the TRL a subjective process, or does it have to be defined from some predefined organism? Who would like to help me answering this one?
Well, from our perspective, it'll be pretty obvious at what stage the development of technology will be at. So it's both an intuitive process, but it's based on industry knowledge as well. So, but it's not coming from a manual, and it's not coming from an encyclopedia or an academic paper. The assessment will be based on the reality of whatever stage of development the solution currently is.
Perfect. Within the founding group of our startup, not everyone is European national. Will this penalize or even disqualify us from entering to a bootcamp? So just to mention already, and maybe you guys can help me contribute to this question, but what needs to be European is the startup. The startup needs to be registered in Europe, but that doesn't mean that the people working on the company or the founders need to have a European nationality. We actually refer to the startup. The startup is the one that needs to be incorporated or registered in a Horizon Europe country. But normally, the nationality of the team members would not have an impact on your selection. So if you have more questions, please make sure to ask on the Q&A. But if there are not more, maybe what we can do is that I let each of the program managers sell their final pitch to their bootcamp and convince you to apply to there. So just in a few sentences, please convince the potential applicants to apply to your bootcamp and let them know why your bootcamp is the right choice. So who wants to start? Okay, I will select then. George, I saw you open your microphone.
Yeah, I can go. So we're all aging. I don't know if you realize that, but I think it's a huge opportunity. This is a market that startups sometimes fail to tackle because they don't validate their solution with users. So our bootcamp is designed around that. So if you have a solution that applies to the aging group 60 plus, come to us, and I hope we can help you really reach the market and take this opportunity in Europe.
Thank you. Lisa, I let you.
Thanks. So the MedTech Bootcamp, we have a lot of experience helping MedTech digital health startups launch their products onto the European market. We have a very deep network of industry, a hospital, also European medical device regulation experts working with us that you will have direct access to. So we hope that you apply.
Thank you. And Brendan?
If you have a technology solution that can resolve the transformational challenges that life science and pharma companies and bigger healthcare stakeholders are currently facing, then we can help you develop those solutions, make them more commercially interesting, redefine and enhance your value proposition, and ultimately, hopefully, enable you to raise further investment and acquire new customers.
Great, thank you very much. So maybe one last question. Hi, I represent a medtech startup developing an autonomous medical devices using AI and robotics. Which bootcamp fits the best for us, and are we eligible? We have a high functioning prototype, but we don't have gathered clinical data. Who wants to abort this question?
It could be interesting for us for sure, but equally it could be interesting for Lisa, I suspect, depending. You have a high functioning prototype, definitely interesting for us. We're not as interested in clinical data necessarily, believe it or not, despite the fact that life sciences and pharma are part of the program. We're more interested in integration and the ability to integrate those solutions into that effective supply chain. So if it can be applied around drug design, great. If it can be applied around any other part of the supply chain that a life sciences pharma company currently operates, great, then we're interested.
Yes, I would recommend applying to both.
Okay. Perfect. So I don't see any more questions. So you can find the slides on the chat. You can also find there on the chat the link to our programs. Javi has also been sharing the entrepreneurship lead contact, which is the people in the different regional offices that you can reach out to, and they actually would be very glad to help you if you reach out to them. So make sure to send them a message, and they will follow up with you through your whole application process. And if these bootcamps are not a right fit for you, they will make sure to find you the program that works best for your very particular case. So once again, we remind you the deadline is on the 27th of June. After that, we won't be receiving any applications. Most of the information that you will need is on the web pages, but if you don't find it there, there you have the contacts of these program managers that will help you answer your questions. So thank you very much for joining us today, and we hope to see you soon in each of the bootcamps. Have a very nice day, and thank you all program managers for answering all the questions. Have a nice day.